Next item on the agenda is we're going to have Dr. Polsky with us again today to give us an update on COVID-19.
Good morning.
Good morning.
Good morning.
Okay. All right. So just give a moment for the slides to pop up. There we go. So I'm going to start out with some good news, and actually most of what I have today is on the positive side. So as you can see from the slide, our number of cases in the county continue to decrease since we had that enormous surge during the holiday period. I will just mention as a little bit of caution that even though we are in much, much better shape than we were a month or so ago, that we're still looking at over 100 documented cases every week in the county. If we go back to summertime, if we knew we were going to have 100 cases in the county, that would seem like an enormous amount of virus transmission. So we are far from where we want to be at this point. With kids getting back into school, I'm very happy to see, you can see age distribution here, that we've had a nice drop down in the youngest age segment, the 0 to 14, and then very, very few cases in what would equate to high school and community college age. The only age demographic that went up a little bit this past week was the 20 to 27, and that was only a modest increase. And then what might be most important out of this slide is on the other end of the age spectrum, the 65 plus and 75 plus ages, where we've seen a dramatic decrease down. So actually, before I get to that, just want to make a mention as we start to transition to talk about vaccines, that we have made a concerted effort to make sure that our more elderly population in the county is getting the best access possible to vaccinations. So in addition to seeing the total number of cases drop, if we go back about a month ago, there were over 35 people in our local hospital admitted with COVID. I think 8 at the peak were in the ICU, with several people having to be transferred out to other hospitals. As of yesterday, we had a total of 5 people in the hospital admitted for COVID, 1 in the ICU, 4 on the general ward. So it's not just the number of cases, but the severity of illness. We've seen dramatic decreases down as well. And then this is an update of slides that I've shown in past weeks. So you can see that these are health departments. These are not pharmacies or hospitals. So for our health department, we're still at over 100%. Again, you can't give out more than you receive. Those statistics are skewed a little bit by the Pfizer vaccines, where oftentimes you can get out more vaccines than. And then relative to other counties, Calvert currently ranks 6th in the highest number or highest percentage of population vaccinated. And then I added this slide in because there's been questions about how vaccines are being allocated at this point. Keeping in mind that the initial vaccinations were going almost solely to healthcare workers, to first responders, and then to nursing homes. So there were a significant number of vaccines that went to younger people because they worked in healthcare fields, or they were EMS workers or firefighters. So when you take a look, the first column are the number of people who have received at least a first vaccine in our county. So 65 and over, it's over 5,000 people now. If you look at 75 and over, over 3,200. And then as a percentage of the entire county's vaccinations, you can see the percentages there. And then the column to the far right are the percentages statewide. So you can see that locally, we've actually done a better job than they're doing statewide in making sure that those vaccines are getting to the people who are most medically vulnerable. And I think that's it for my slides. Questions?
So I do want to thank you for coming in. We've got you coming in every Tuesday. We've gotten a lot of good feedback. People appreciate the fact that you're coming in and giving them updates so they kind of know what's going on. Yeah. And just to reiterate again, we can only give out vaccine based on what the governor has allocated to us. So last week, the federal government started doing 4-week projections for allocations. So Calvert, our projected allocation for the next 3 weeks now is 700 doses. 500 of those go to the health department. 200 of those are going to the Giant in Dunkirk. And you can correct me if things have changed since then. The newest wrinkle that occurred last week or the week before was that now the federal government is doing direct allocations to CVS's and Walgreens. So last week, Dunkirk, CVS was doing vaccinations. Walgreens started doing some vaccinations. I don't know if you know what their allocations are of how many people they're doing. I did get a complaint last Friday. An individual was in line at the CVS at Dunkirk, and in his conversations with the other people there, he found out that they were from Prince George's County, Baltimore County, Virginia, Pennsylvania, and New Jersey, which didn't make him very happy that he was the only Calvert County citizen in line that day for a dose at the CVS. And then when he got up to the counter, the person there didn't ask for any identification. The girl basically said, "We don't care. Our job is to give out shots." So it's creating all this confusion. We're still getting the complaints from people. I'm 72. I haven't gotten a shot yet, and my neighbor's 51, and he got a shot. The only thing I tell them is what we've been consistently saying is that, Dr. Polsky and his staff is doing the best job they can with the doses they get to go down that list. And that, there's just not enough vaccine to go around, and you just have to be patient. And but it's quite a challenge.
Right. And Commissioner Hance, you're correct. So the health department is projected to be limited to 500 doses each week, at least for the next 4 weeks. We don't know beyond that. The Giant in Dunkirk, you're correct. They're getting 100 doses for a first dose and an additional 100 doses for a second dose. So they're only able to take in 100 new people each week. The hospital, our hospital, was being allocated 100 doses a week. This week they were projected to get 200 doses, so that may help us some. And then for the CVS and Walgreens, I was able to get some information from the Walgreens in Prince Frederick. The pharmacist there said they were expecting 100 doses a week. I couldn't even get through to the Walgreens in Lusby. So I'm guessing it's the same, but I'm not sure. And then the CVS up in Dunkirk, apparently they don't know from week to week what they're getting, and they've gotten varying amounts. And for this week, they don't know what they will be getting as the week goes on. The only doses that we have any local control over are the ones coming to the health department and the ones going to the hospital. As you mentioned, the pharmacies, it's whoever can grab them first. There is no centralized registry, and I've seen bits and pieces of information from the mass vaccination clinics, which is also whoever can grab them first. And apparently the 2 counties with the highest number of residents getting vaccinated at Six Flags, one in Prince George's, are coming from Montgomery and from Howard County. And so it would be nice to have more control locally over the vaccines. If we were getting a proportional amount, we should be getting about 1,300 doses a week in Calvert to be used for, at least primarily for Calvert residents. And again, between the hospital and the health department, we're looking at 600 or 700 doses a week.
So, Doc, with the inconsistency of all this stuff, somebody goes to CVS, gets a shot, they get one, and now they're struggling to get a second one. Does it waste the time that they did the first one? I mean, is there any value to the one? I mean, do they need 2 to make this happen?
They do need to. I can talk for a second about the Johnson & Johnson vaccine, which may get approved either later this week or early next week. But for the vaccines that are out right now, they're both 2-dose series. And wherever someone gets their first dose, they should be able to get a second dose at the same location. Every vaccinator is being allocated a first dose, and then there is a companion second dose specifically for them. What we can't have is somebody goes to CVS for their first and then tries, say, to come to the health department for the second, because we get a specific number of second doses for those we've already vaccinated. If we give them one of our second doses, and somebody we vaccinated for first, we don't have a dose for their second.
And how do you regulate that?
Well, so we've already had some issues with people going to Six Flags or other places. They don't want to go back and travel. They want to come here. And unfortunately, we have to turn them away because giving them one of our doses means that we would then be shortchanging or denying someone who we vaccinated locally. And so everyone, no matter where they go for their first, the take-home is that they need to go back to that specific location for their second dose.
And if they don't get the second shot, what happens?
Well, we know that the immune response starts to diminish more quickly with only one. So people will not be as well protected. And we don't know how long that immunity will last. But so it's important to get the second dose to make sure that you're going to have lasting protection. It also, from the first dose, you don't get full protection. So you get pretty good protection, but it doesn't get boosted up to, when you hear that 95% protection, that's 2 weeks after the second dose, then you're up to 95% protection.
So the only other thing I'll add is people that have gone through the vaccination site down at the industrial park say it's an excellent process. It's very seamless, pretty quick, and very thorough. But people are just gonna have to bear with us because there's so many circumstances beyond our control that it just is what it is.
Right. So we know that currently we have close to 1,500 people 75 and over still on our county registry. And certainly if you do the math, it's going to take us at least 3 weeks to get through. Now, some of those people may be vaccinated elsewhere, which may help move us along more quickly. But we're still looking at least a few weeks before we can then move down to the 65 to 74 age bracket.
So have you completed the 75 and up yet?
No, we still have about 1,500 people
Okay.
there. And also to keep in mind that local health departments are still tasked with making sure that all first responders and healthcare workers are vaccinated, and workforce does not stay static. So when somebody new starts to work at one of our volunteer rescue squads, then we need to have doses for them. When the medical office hires somebody new, we have to have doses for them. So those 500 doses cannot be purely put toward our 75 and over, or eventually our 65 to 74.
And there was some talk about we didn't get deliveries last week because of weather.
Correct. We got 0, and that goes, I think, for everywhere across the state. So we did get a delivery on Monday, yesterday, for the doses we should have received last week. Because of the weather and the ice in particular, we did postpone 2 days worth of clinics. So we didn't run out because we had to postpone those. And then those people are already scheduled for their follow-ups.
Okay. Any other questions? Well, thank you, Dr. Polsky.
All
We
right.
just
My pleasure. Thank you.
appreciate all your effort.